big challenge is awareness of what programs exist in a local area and utilization of those. We need to do better about raising awareness to address that challenge. Information, accessibility, and awareness of local, federal, and state, honestly, programs, benefits, waivers, community-based things. This is what we're interested in trying to bring more online in a streamlined approach. These under-indexed, I guess, programs and opportunities to get some help.
Welcome to the Blueprint Breakers podcast. What is a blueprint breaker? If you live your life outside the typical traditional lifestyle blueprint, you are a blueprint breaker. We are here to start a conversation, to assemble resources, and to build a community. This podcast is for empowered women in midlife and beyond who are preparing for a powerful next era of life. My name is Amy A. Palmer. I am your host and facilitator for our conversations. Sit back, relax, enjoy the show. To stay connected, up to date, and to receive all of our free resources and gifts along the way, join us at community.blueprintbreakers.com. Today's episode is Caregiver Resources. And I speak with special guest, Dr. Logan DuBose. He is our very first male guest here on Blueprint Breakers. And I felt like his mission and what he is doing is so important for us as the Blueprint Breaker community that I had to introduce him to you and his company. He is a co-founder of Olera Incorporated. You can find it olera.care online. So we talk about all things elder care. We talk about what the elder care landscape looks like right now, the complexities of it. We talk about, as caregivers, what kind of support and resources. What about if we have financial challenges? How do we address those? This conversation is rich with information, with data and statistics, and support and resources. So listen to our conversation. Let me know what you think and enjoy the episode. Hello and welcome, Dr. Logan DuBose. Welcome to Blueprint Breakers. It's so glad to meet you and see you today.
Amy, it's great to be here. Thanks for having me.
Well, let's jump right in because, the reason why we're here is because your work of what you're doing and how you're serving is so critical to the Blueprint Breaker audience. So I really want to cover a lot of ground together. Why don't we start with what caused you to get involved in supporting the aging population? What was your motivation behind that?
Absolutely. It's both personal and professional. My grandfather has dementia. He has vascular dementia. And so his spouse, my grandmother, is a spousal caregiver. And then my mom is an adult caregiver of him. So over the last 5 years, he has had progressive decline of his ability to move and drive, for example, or take his medicines. With all of these, as you may know, or anybody who is taking care of a loved one who loses those abilities, it's a big responsibility on the family often. And so I've watched that caregiving process from a personal standpoint with my mom and my grandma. And then from the clinic standpoint, working in the hospital as an intern last year, I was in my training to be a physician. I'm an intern in residency. I've noticed a lot of times discharging patients from the hospital, there's often not long-term care support.
That's right. Mm-hmm.
It's very frustrating when you're in the hospital as a physician trying to provide a safe discharge plan, especially in the case in the elderly when mobility is an issue, memory problems persist. Finding safe long-term care solutions and home care solutions, or even legal and financial social work situations, very, very hard to secure outside of the hospital. And so all of those reasons combined, I've been working with our team to try and come up with ways that we can use the internet at first to deliver information on long-term care support resources for families. And that's where it started. And then it's kind of taken off from there. And I'm happy to talk more about it. But the motivation is both personal and professional. I'm trying to keep people safe outside of the hospital.
Right.
It's one of my biggest motivations.
Yeah, that's interesting. So you identified the need for it by seeing that both personally and professionally. Why do you think people are so unprepared? Do you have any thoughts on when you say that there's no like long-term care plan in place, or what do you think is the reason behind that?
Yeah, Amy, I think that's a question I think about a lot. Maybe we can take it from the standpoint of a recent research study that our team did. This study, and I'm happy to share the results in the paper we published after this call. I can send this to you for the group. But we ask families, what are the biggest challenges you're facing providing care for a loved one? And this was specifically families taking care of somebody with dementia or memory loss. And some of the things we found were the following. Number one, affordability is a large barrier. Right now, home care is somewhere between $20 and $65 an hour. This is somebody to come into your home and help you with maybe toileting or bathing or cleaning. That's a very expensive. And assisted living is upwards of almost anywhere from $3,000 to $8,000 a month. That's much more than most people pay for rent.
Right.
And so affordability was a big challenge, accessing information and interpreting information online. So though there's a lot of information online about where to go for support, like the Alzheimer's Association, or to go to an aging agency like the local area agencies on aging, though there's a lot of information that exists online, people have a hard time. Maybe it's sometimes a lack of technical skills or maybe even literacy level, but finding that information online and saying, yes, I know what to do. I know how to contact an assisted living, or I know how to apply for the assisted living waiver, for example, so that I can afford care. So both a financial and an access information delivery. And then also there is the elephant in the room, that the elder care ecosystem, we call it, but really it's a complex network of different fragmented providers. So you have healthcare, you have elder law attorneys that come into play. Most people will at some point need to use an elder law attorney to get advanced directives or estate management. There's financial, retirement savings, long-term care policies, and insurance and financing care. There's different services, professionals. There's even medical goods like durable medical equipment you have to source and find and understand and purchase. It's a huge ecosystem that a caregiver finds themselves going through. It's very fragmented, and there's not a streamlined process in the US right now that guides you through that on a kind of a white glove service. Is what I would love to see, is where families could get walked through this when they discharge from the hospital, this ecosystem, avoiding these financial and access barriers and navigating the ecosystem. So it's very complex. I guess those are three things that I would say to answer the question, why is it so hard to feel safe about discharging a patient from the hospital? It has a lot to do with those three things. And sorry, my cat is joining us.
It's okay.
I'll have to ask her to.
I welcome pets and kids and whoever comes along. It's great.
Thank you. But thanks for that question. It's a very big question, a very pertinent question. I think it's one of the biggest questions we're facing right now in the U.S. is the long-term care infrastructure. Why is it so difficult to navigate?
Yeah. Well, it seems like it's potentially overwhelming, and a family probably doesn't even know where to begin, and try to sort through the information. So that's a great point. All of this sort of led you onto the path of launching Olera, or so tell me a bit about your company, your mission, how that all came about.
Absolutely. Well, I think I've already kind of mentioned my personal mission as a physician and a training physician. My goal with the initiative Olera.care is our website, is to have something to hand folks when they're leaving the hospital that I feel like will at least give them some sort of guidance to navigate this complex ecosystem. At least, I started with thinking like, what pamphlets, what articles, what videos could I share or could I consolidate and hand to somebody when they're leaving the hospital, besides just the discharge paperwork and their next follow-up appointment? There's a lot that happens in between there.
Right.
What can I hand them? And I couldn't find anything that I thought was consolidated. I had a lot of websites, but a lot of folks, it's very difficult to navigate those websites and to understand them. So I was thinking, what can we do to simplify this? We ran into an opportunity. When I say we, our team formed out of Texas A&M through a student entrepreneurship, medical entrepreneurship group. It was an organization. We said, we want to work on aging. What are some of the biggest problems? We said, well, people are getting discharged from the hospital and they're still sick and they're getting sicker and they're coming back to the hospital in a vicious cycle. Maybe information delivery is what we tackle. Maybe we try to address information gaps. Maybe that's something we can do. We got a grant from the National Institute on Aging that's then taken the project to a new level, which now you'll see on olera.care, families can log on, they can answer a few questions, and we've tried to map this elder care ecosystem and kind of tailor recommendations. Maybe you don't need a memory care unit right now. Maybe you just need education on that. But maybe you could consider thinking about a volunteer support respite care, adult daycare in your area. These are types of situations that we're trying to map out all of the services and useful organizations and aid programs in a given area and tailor that information for you so that you can look at it and consider it as a first step towards trying to fill this information gap that exists from, a clinic visit or a hospital stay, and then getting to your primary care. What happens in between there? What happens at home?
Okay.
So that's kind of our motivation. That's where it came from, was this grants trying to resource match individuals and provide this information.
Now, is it specifically for those with dementia or Alzheimer's, or is it elder care more generally?
Our research is specific. The research study I mentioned already, and our follow-up papers and work that we're doing is specific to dementia caregiving. However, we've designed the website to be helpful to anybody who is taking care of a loved one, regardless if they've been officially diagnosed with dementia. Really, care services in the elder care ecosystem is very applicable to all sorts of challenges people might face taking care of anyone with disabilities of any sort.
Okay. All right. So based on what you've seen and researched, et cetera, what are some of the most common challenges that caregivers are facing? Right.
And so I think, we've talked a little bit about accessibility, we've talked a little bit about financial, talked a little bit about the fragmentation, the many, many different services and providers and medical goods, durable medical equipment that you need. Those would be the top three. I think maybe the feeling of not knowing where to start, not knowing who to go to, maybe is something we could talk about for a moment. I think a lot of people, from what I hear and from the research, go to a primary care doctor, they go to first, or they'll go to their friends, family, and churches. So maybe a challenge is online. If you were to search for a support group, for example, or a church-led community program for like respite care, there's a lot of churches that have once a week where you can have some respite care. You bring your family member with dementia or a disability up there to the church, and they spend 4 hours, and you can go do groceries or errands. One of the challenges is that these things don't get a lot of real estate online. Support groups, respite care, volunteer programs on the community level, sometimes the information's not updated, or maybe people don't know to search for respite or adult daycare online. So a big challenge is just navigating the internet to find underutilized existing programs that just aren't getting a lot of spotlight. There's a lot that the communities and caregivers, they're really the backbone of the infrastructure right now. And so there's a lot that's going on, but these leaders might not always be the best at navigating how to bring awareness online for their service or for their community program. So that's a big challenge, is awareness of what programs exist in a local area and utilization of those. It takes hours of research and thinking and knowing and talking to people. What exists in my community? I have a challenge. I can't get to the grocery store because my loved one wanders or might be unsafe.
Right.
What exists right now? What do I even search on Google to figure this out? Who do I call? So that's a big challenge of like, just where do I start when I'm trying to solve a challenge? Can't call the doctor every single time, and the doctor often doesn't know a lot of the time. So we need to do better about raising awareness to address that challenge. Information, accessibility, and awareness of local, federal, and state, honestly, programs, benefits, waivers, community-based things. This is what we're interested in, trying to bring more online in a streamlined approach. these under indexed, I guess, programs and opportunities to get some help.
Right. Yeah. They might not be search engine optimized, right? That like the information's out there, but it's just not coming up, or it's maybe pages deep into your search.
Let me tell you a crazy statistic that comes to mind that I read. We just wrote a little bit about this too. So aid programs on the federal, state, and local level, like for example, nutrition programs that will give you a stipend for food
Mm-hmm.
or supplemental social income that can
Mm-hmm.
give you a little bit extra. So $30 billion a year is not used. It's not used, even though people qualify for it.
And need it.
And it's because, and this is what the data shows when you do these surveys and such, it's because they didn't know about it, or they knew about it but didn't know how to sign up.
Mm.
So $30 billion. And with, prices and everything and the economic pressures we're facing today, it's just outrageous to think about this money being left on the table. It's designed for the elderly to help them. So that's what we're also trying to kind of think about. What is the biggest challenges is getting people to utilize this aid. How do we do that? How do we help people
Mm-hmm.
along the way? So anyways, I always find that like strikingly crazy when I read it.
Yes. I mean, anecdotally, some of my friends and peers, the challenge that they have is in finding good, trusted care too. And not even just from a skill and competency level, also how receptive or non-receptive their loved one is to any particular person. So, I mean, I've got multiple friends who are navigating that and having challenges with that, along with the challenge of the affordability aspect of it. Do you have any like
Yeah,
thoughts or ideas around that?
I do. So what's interesting is, we set out trying to help families connect to resources. And a lot of the time it is personal caregivers to come into the home and help with what in the medical industry we call ADLs, activities of daily living.
Mm-hmm.
So to help with bathing, cooking, cleaning, taking medications. This is actually one of the number one demanded things. It's not like a nursing home. That's
Right.
typically not where people need to go or want to go.
Mm-hmm.
It's home in the care. So I'm not surprised that, you know, anecdotally, many people are have friends or themselves are struggling trying to find this, because here's what we found. When somebody calls into olera.care, our hotline, and expresses the need for home care, when I call the home care agencies around their area, sometimes they can't take the client. And this is because they are understaffed. There's a
Mm-hmm.
crisis going on,
Right.
understaffing of home caregivers across the country. In fact, 89% of home care agencies across the country have to turn away business because they do not have staff to fill the shifts. So it's no surprise. And then also check this out. The turnover rate of home caregivers is 69% each year. So if you hire a caregiver and you're an agency,
Mm-hmm.
there's a 69% chance that that person will not work for you anymore after that. So when you mentioned that finding the right match of a
Mm-hmm.
caregiver and a patient at the home,
Right.
that's hard to do when every year an agency is turning over and you have a new caregiver all the time, because the industry is struggling. And one of the reasons that things are so expensive for home care, it's a whole macroeconomic system. There's economic pressures on the home care agencies. They're having to charge more in order to stay afloat. They're having to pay caregivers less to stay afloat. That leads to turnover for caregivers.
Yeah.
That's a problem. So what do we do with all of this? So I think there's a huge crisis. I think one of the biggest problems that we have is a lack of home care professionals that are trained, and purpose is to go to the home and to have a relationship over time with an individual that's disabled or elderly.
Mm-hmm.
And then to stick with them over years, they need to be well trained, well paid, well respected. Right now, caregivers, I hate this term. This is what the medical unskilled caregivers, ridiculous name. We need to flip the whole thing on its head. These caregivers are professionals. They're
Mm-hmm.
well trained. They need to be well paid. We need to well staff them. We're working on trying to have students, pre-health students that are trying to go to medical school or nursing school or PA school, PT school. We're working with Texas A&M right now and Senior Helpers, Bryan College Station, which is one of the leading care agencies. We're working on filling their staffing shifts that they have unfilled with students, part-time workers, try and get the intergenerational positive effects of working with the elderly and the elderly working with the young. And they need clinical hours and experience for school, and the families need care at a more affordable rate. So we're hoping that that will work. We just launched that pilot this month. But that's what I have to say about caregivers at home. It's very hard to find professional caregivers. Finding quality caregivers that don't turn over every year, 69%, going through an agency sometimes isn't the answer. Then there's the private sector. You can go through care.com, for example, or you can hire somebody, a friend or family. That comes with its own complications. Being a household employer, if you pay over a certain amount, you have to go through the legal things of that. And there's no clear evidence or clear guidance. So the best I could say is if you are completely lost, we're happy to talk with you, our team. You can call our number. I'll send it to you after this. And during business hours, we can get to you and at least give you some information in your local area, the caregiver agencies that we've trusted and we've vetted so far.
Are there other options that we should consider if we're in an area where it's really difficult to find quality in-home care, especially if it's not medical, if we're not looking for like nursing care,
right?
Is there some other things that we should be looking at or consider?
So the first place to go, so this is a very difficult challenge too, because the service areas of home care agencies across the country, there's gaps. There's gaps in the service area. So we call them deserts. There's deserts where there's no home care agencies or one, maybe two, and they don't have staff, and that's a problem. So what do we do? And there aren't great answers, to be honest. But what I recommend first, there's always a local area agency on aging. Area Agency on Aging is their name. There's always one with a phone number, and they have programs. They should be aware of programs that are volunteer based. So that would be they have lists of individuals typically who have signed up for volunteer based programs. You can try and call them, and they might be able to come out to your house and help you once a week, once every other week. That's one place, is the Area Agency on Aging, and that's all across the country. The other one is your local churches, and this requires a little homework, but local churches typically have, if you called, the 8 or 9 churches in your local area, it's bound to be one of them have a program. So it'd be just looking up online their phone number and giving them a call and saying, I'm a caregiver. I was wondering if you all have any community-based programs available for caregiver support. You'll be surprised. Many churches have, like I said, afternoons where you can get some respite care by dropping your family off safely at this church where they'll do activities and such. So that's another piece of advice. And then also, again, just give us a call. So what we do whenever somebody calls in, if it's an area we're not familiar with, or it's an area that we know is kind of a desert, we will call for you. We'll call every place around, anywhere close, and we'll talk with them. We'll try and see what we can, if we can get it, somebody to make an exception. So we're happy to do that groundwork too. It's completely free. All of our services are free. You can call us and we'll do everything we can. Unfortunately, that's not a problem that we've solved yet. So the answer long-term, we need more home caregivers.
Yeah.
So that we can make more home care agencies with vetted, trained individuals and try and fill some of these desert gaps where there's no care.
Okay. Yeah. How about for someone brand new to caregiving, or it's like on the horizon for them? What can they do to best prepare themselves, their family, their loved ones for this? Right.
So when my family was in this situation, personally, I was blessed to have, my grandfather had a great relationship with a primary care provider. This provider's name's Dr. Dalal. He is an excellent internal medicine physician that's been working with my family since we were young, and it's been working with my grandparents. Not everybody's so lucky, but what I would say is this. I would recommend personally that you find your primary care doctor the moment that you feel like there might be a concern for memory loss. The other two things is a concern for driving. If there's a
Okay.
concern for driving, I would definitely go and speak with your primary care doctor. If you don't have one, then it's not easy sometimes to find a primary care doctor. We're happy to, you can call our line. We're happy to call around for you too and try and see who has availabilities, but you can search for primary care doctors near me. But the primary care doctor, the reason why I think that's a great place to start is they can help you understand what a diagnosis looks like, precautions such as did this primary care doctor feel that you were at risk of falling or at risk of hurting yourself driving or at risk of going to the hospital for any sort of medication errors that might occur, blood thinners or hypertension medicines. We need to make sure that everybody can drive well, can move well, use the restroom okay, and can take their medications. That is a good place to start for a new caregiver is why don't we go speak with the primary care doctor or find a primary care doctor and get a head to toe physical assessment and talk about memory loss and talk about the stages, which again, I kind of mentioned it, but I call it the knees and the keys, the knees and the keys. When the keys go, that's a big step and you'll need kind of a primary care doctor on your side to help navigate the paperwork or to have those conversations. When the knees go and you can't get up and move anymore, there's a host of things that we'll need to talk about. Just how are we going to use the restroom? How are we going to get food? How are we going to take medications? So we'll need that medical person on our team. And so
Yeah.
that's where I'd recommend the first place we start. And then after that, I would say your friends and your family are the backbone of the long-term care industry or long-term care infrastructure right now. So talking to your friends and your family, and we're also happy to kind of share some articles and stuff about how to bridge these topics with siblings. If it's a parent and you have a sibling who you're taking care of or a spouse, how to bridge these conversations and start the conversations on what's essentially a checklist. We're developing a checklist of legal, financial, and functional care related considerations throughout the different stages of, we want to say dementia, but really it can be age-related decline too. There's a fine line between dementia and age-related decline, and Alzheimer's is a fine lines,
Mm-hmm.
but really at the end of the day, there's clear stages. There's, the first time that you're concerned about memory, there's the keys, not being able to drive anymore, the knees, not being able to walk anymore. And then memory can kind of wax and wane all throughout that, depending on the case.
Okay.
So I would, again, I guess I'd say friends and family and your primary care doctor first, and then come to eldercare after that, or during that if you need some help. And we've got lots of information as well on the different stages and different challenges that you might face along the way.
Okay. So you've compiled those checklists of things to consider along the way?
Yep. And so we're working actively to make it as usable as possible and as filtered as possible, because we don't want to make, I wouldn't say it's a mistake to have a lot of comprehensive information in one place. That's a great thing, is to have a lot of information, but it can be overwhelming. And so if you're the kind of person that likes to read a lot, log on to the website right now. We've got almost all the information, on the common topics and challenges, a lot of information on it. But we're actively working for those that might not want to spend hours and hours reading and extracting. We're actively working on a smart filter where you can type in, answer 6 or 7 questions and you can get some targeted information, for example, driving or how to find support groups. If that's most relevant to you, then we'll try and only present those things to you.
Right.
But we're still working on trying to solve that problem. How do we deliver complex information simply and streamlined?
Okay. Well, so you've already mentioned quite a few things that elera.care can provide and to help. Is there anything else that you haven't mentioned yet that you do?
Yeah, so there's three main things. So you can use it simply as a directory, kind of like a Rolodex, you could think. A Rolodex or like a Yellow Pages. It kind of functions where you can type in your city or zip code and you can look at many care categories of relevant services or education. for that area. We have what you would expect, which would be home care, which is both home health and non-medical home care, nursing homes, from memory care to assisted living to independent as well, but also some services that other directories don't do very well. We have elder law attorneys, financial advisors, and insurance experts. We have support groups for family caregivers. So these are some of the ways that we're trying to have a browsing function where you can just simply type in your zip code and look what's available and review those things. So that's function one. And then we have a hotline where you can call during business hours. We'll answer, or you can leave a message and we call you back. And this is if you just have any question at all and just want to talk to somebody who has studied the elder care ecosystem, and it's a free service. We're not necessarily a social worker, or a case manager, but we can help assess and help identify resources that could meet your needs. We can do that on the phone. So that's the second thing that you can do. And then I've mentioned this personalized, smart, filtered way to view education and to view our database of the elder care ecosystem. We call this the Caregiver Relief Network, the Caregiver Support Network as well. Also, we'll call it both things. And so this is a network of providers that we recommend and educational articles that we recommend after talking with them, understanding their services, vetting them. We put them into a place where, and right now this is most live in Houston, Texas, and we're slowly branching out to the other states and cities. But that's the third thing, is you can go to the Caregiver Relief Network, which is a more personalized view of services and education for your area and for your situation, hopefully. So those are the three things that you can do.
Awesome. And you mentioned that this is all free to the user to be able to access this information. So how is Alera funded, or like how can you afford to keep that running?
Yeah, absolutely. So it's a challenge. It is. And one of the reasons why the National Institute on Aging funded us currently with a grant, so this is a grant funded at currently, was to research and develop this system and find a way to sustain it after the grant's over. So we do need to find a way to sustain this directory that can be filtered in this smart way, this hotline that we have. We have to find a way to sustain this monetarily. Right now, we're committed to not charging the family caregivers or the families and users because, like I said, one of the biggest challenges is things are so expensive already.
Right.
So we're committed to finding creative ways to monetize our website after our grants finish out. Now, we did just apply to another grant and we'll continue to apply to grants. So that will give us more time to figure out. But here's what we're currently doing. Currently, we have community corporate partnerships. And these are vetted home care agencies, assisted living facilities, memory care agencies. These are vetted individuals who we trust and who we think families trust, big brands that have been established that we've talked to. And so these individuals can give us some fees for advertising them on our website. Now, we're very careful about making sure we don't introduce bias of any sort to users, but we do have to strike a balance, right? And so we're working on that. And then another thing that we're working on is the staffing issue that we spoke about. Is trying to establish ourselves as a staffing assistance organization. We assist with staffing home care agencies. And there is revenue that can sustain our business or our work that we do with helping families by helping the service providers as well. So we have kind of two customers. One, we don't charge anything, and that's you and your family and the users who want information on caregiving. That's a customer, but we want to keep that free. And then there's service providers who we also have many free services for, listings that they can place and such. But there's premium things that we can do to help service providers that we can charge them for, and they're happy to pay it because they want to help families too, and they want to raise awareness online of their services too. And so we're hoping that we strike this win-win balance, and we're just early in that stage of monetizing our website. But it's very exciting to see some of the initial successes of these corporate partnerships, because we do believe that when grant funding is complete, that we'll be able to sustain the business. That's our hope, and we're working hard to do that.
Awesome. Now, I know that you're also committed to supporting families in terms of discovering like financial assistance. So can you speak a little bit to that?
Absolutely. So we're currently looking in Houston, for example, at all the financial advisors who will offer free 30-minute consultations and who specialize in elder care concerns or elder financing. The same thing with elder law attorneys. Now, you would think, when we're talking about financing, why would I need to talk to a lawyer? Why would I thought that was confusing, but really it's actually quite important for many cases in asset management and arranging how your house, gets transferred to your kids, for example, or how you could qualify for certain financial benefits from Medicaid, for example. So you might need to talk to a lawyer in order to spend down your assets. They call it spend down assets, Medicaid spend down. So that's a common thing that we come across is how can I get care paid for by qualifying for Medicaid? Well, in those cases, you actually need to talk to both a financial advisor probably and an elder law attorney in those cases. So how we help families navigate this is first try to assess what is your ability to pay currently? What are the resources and tools you have? Is it Medicare? Is it Medicare Advantage? Is it Medicaid and Medicare? Is it private insurance on top? Do you have VA benefits? This is the first starting point, right? And then from there, what are your needs and what more do we need to figure out how to finance? And then what are our tools that we have here? So this is very complex. Elder law attorneys and financial advisors that specialize in long-term care financing. These are the individuals we're talking to. We're trying to make great listings for. We're trying to verify that they have free consultations for families, talk to them ahead of time so we can establish a pipeline of this sort of advice. That's where we're starting right now. And then we've got some cool ideas about inventorying all of the aid benefits, waivers, discounts, trying to index all of that exists in a small area. For example, like we just looked at a zip code in Houston. What are all of or Houston as a whole, what are all of the aid programs that exist? How can we then take the questions we ask somebody and quickly eligibility screen them for 10 or 15 things?
Yeah.
Kind of like you can think about like TurboTax kind of does this a little bit, like when they're thinking about if you've ever used TurboTax and it's like, what deductions am I eligible for? Right. We'll ask you some questions. Well, I want to create something like that for like aid programs to save people money. Because like we said, so much is going underutilized because people don't know about it or don't know how to access it. So that's another way that's on the horizon. So until then, we're just trying to connect people to individuals who get free consultations and that are experts or specialized in financing care until we get that technology developed.
Great. Before I ask you this last question, because I do want to ask you sort of about your long-term vision with Alara. How about when you're talking about like financial situations, what about long-term care insurance? Do you have any thoughts on that? Or
I do.
When is it too late, or, is it worth it?
So that's a great question. So what is long-term care insurance? So this is kind of usually a supplement on top of what people typically have, which is Medicare, for example, if you're over 67, 65, 67, different states, and Medicaid. So you could also have a long-term care policy where you might get an extra amount of money each day, for example, once you start to claim that. And so you might get an extra amount each day to help with home care, paying for a caregiver at home, or maybe even applying that towards rent, for example, to an assisted living facility. Certain policies do this. You ask a great question. When is it too late? So policies differ. And so this is why you would need to talk to an insurance expert, which on Alara, we have some insurance experts that can help you navigate this. But policies differ. Typically, it's you usually want to be paying into it before you're 40, around 40. So if you haven't and you're listening to this and you say, oh no, I'm scared, what am I going to do? There's still options. You can start later on. But it's a monthly premium, just like it would be for a private insurance. And it's just for that extra help when you do turn a certain age or the knees and the keys, situation happen and you need some extra help. This is a type of policy that can give you extra money. Now, I've got a lot of great thought. I think it's a great thing to do. If you can afford it and you're thinking ahead, we should all be doing that. I'm actually going to start looking into my own soon. And so I think it's a great thing to do if you have that. Now, I will say that very few people have this. It's like 5 or 10%. If I don't quote me on that, but it's in that magnitude of a vast majority do not have
Yeah.
that resource.
Yeah.
So
It's a little pricey, especially the older that you get, obviously, the pricier it gets. So but it's hard because it's gonna be very pricey down the line, right? So,
it is, and I would recommend at least having a conversation about it with a free, 30-minute consultant, an insurance expert who specializes in these sorts of policies. They can at least give you a good conversation on a, remote call or a phone call, talk about your situations, talk about how long you could pay into it, what that could look like, look at your budget. But unfortunately, it's a great resource that many don't have access to right now due to funding
right.
issues, financing issues. I wish we had more things like that were more affordable and accessible. It would solve a lot of the problems I see trying to, secure safe discharge at home. If I knew that this individual would have access to $80 a day, $100 a day for their care needs,
Mm-hmm.
that'd
Yeah.
help a lot.
Yeah. Great point. So let's talk about vision. Where do you want to see eldercare go? Like what do you ultimately want to achieve?
Right. So just going back to my very first motivation, I wake up every morning because I want to create something or to contribute to something that will make my patients safer when they leave the hospital, and that will make me feel less uneasy because I know that there'll be a resource or a group that can help them navigate where do I go from now?
Right.
Where do I go from now? So yeah, so that's my number one motivation, and that's what I'd like to see Olera become, to become something that I can truly, scan this QR code or visit this website, make an account, type in your, answer the prompts, go through the quiz, and you will have something to work on and to see and to call before I see you in the clinic 4 weeks from now. That's my dream. I think we'll be able to get there. One thing that is on the horizon for us, the big picture, is we'd like to start working directly with social workers. I'm not sure if you're familiar if you've ever worked with a social worker or case manager.
Mm-mm.
These are miracle workers. They really are. So they're a profession that solely exists to help connect families to resources based on their needs, and secure the safety of their basic needs at home.
Yeah.
They typically are right now in the hospital, so they'll assist me, almost acting as an extension of the physician, to secure the pharmacy has the medications, the insurance covers the medications. They have a ride to go get the medications. They have a ride to the follow-up appointment in 4 weeks. These individuals are miracle workers because they do that hard work. They do the calling. They'll schedule the appointments. They'll call you, to remind you of your appointment, make sure you have a ride. This sort of hands-on holistic care coordination is another big dream of mine, is to figure out how to leverage technology where it can be leveraged, and the human touch where it should be critical, and it is critical. How do we merge those things so we can scale this sort of care coordination, this hands-on holistic? Because a lot of folks don't use the internet, so we're missing people. Even with the best website in the world, we're still missing people.
Right.
So we need to figure out a way to scale the miracles that social work does. And so we're going to start working on that. That's a big vision of mine too, is I'd like everybody 65 and older, or anybody who's identified with Medicare, to have a call maybe once a week, maybe once a month, from a trained care coordinator who can help them break down these barriers to their basic needs being met.
Yeah.
That's the vision that I'd like to see happen. There's no reason we have everything we need in America to make that happen. We just need to organize.
Yeah. Wow. What a very meaningful and important vision. So I'm with you 1,000% on that.
Thanks.
Thank you. Thank you so much, Logan, for being here today and sharing all of this. I love all the great work that you're doing. I'll make sure to put the information in the show notes, the website, the hotline number, and anything else you'd like to leave with the listeners before we sign off today.
Absolutely. Again, thank you. Podcasts like this and groups like this banding together. I said it before, I think families, friends are the backbone of the long-term care infrastructure. It's how we currently survive outside of the hospital, is the help of family caregivers and informal caregivers billions of dollars of unpaid work each year that they're doing to make sure that people stay safe and get to their appointments. So thank you. And thank everybody out there who is supporting somebody with disabilities. We need you as a medical community. We're racing to meet up with you. And thank you for your hard work until us doctors and nurses and social workers can get to the point where we can take some of that burden, that caregiver burden off. So that's what I'll leave you guys with is it's hard work being a caregiver. I've watched my family do it. I'll be someday in that position. And then professionally, I see it, every day. It's hard work. And so patience and grace for yourself over time. And we're working hard to try and support you more and more.
Thank you. Thank you so much for being here today.
Of course. Thank you.
Thank you for joining me for today's episode of the Blueprint Breakers podcast, Caregiver Resources. A very special thank you to Dr. Logan DuBose for sharing your work and your resources from eldercare. And for you, the listener, thank you for your 5-star reviews on Apple Podcasts. And thank you for sharing and forwarding this episode to your friends. If you haven't joined us already in our community, in order to be on our email list and our gift list where I share additional resources and free items, please sign up at community.blueprintbreakers.com. community.blueprintbreakers.com. Have a wonderful week. Keep on breaking those blueprints and rewriting your own.